Senator has the floor.
A few comments ago, and like pardon me. Thank you. Virginians in my district are willing to accept some degree of incremental market-based health care reform. However, they clearly are rejecting this comprehensive takeover of the system that does not address the core changes. As many of you know, the issue of health care is where I spent most of my 30 years of my professional career, time, and energy. And I founded a company that had the vision of providing health care access through a physician in an organized system of care to many Americans. And I can assure you that when you're involved in these problems day to day, they're quite different than the 30,000-foot level that we're often asked to debate about in these rooms. So it's from that point of view I proceed. What does matter, I think, and what is desperately needed is a healthcare system that encourages responsibility, is market-based, controls cost, and provides access for quality care so that Americans can live healthy and independent lives. And despite how deeply partisan this issue has become, I don't think that Democrats or Republicans can disagree on these goals. In America, we don't let people get sick or die in the streets for lack of insurance coverage. Our hospitals are required to treat those that walk into their emergency departments regardless of their ability to pay. And no one is suggesting we change that, but emergency room treatment for routine sickness is far more expensive than a primary care physician and therefore drives up the cost of health care and serves as a hidden tax of hundreds of billions of dollars for those who do pay for health insurance. My point is that both parties appear to agree on a couple of things: that Americans have access to treatment when they are sick or hurt, and that personal responsibility and cost controls are needed. But while the goals may be the same, there's a grand canyon of divide on how we get there, and the current administration's proposal have helped to demonstrate just how wide this fissure is. To support government mandates in this environment is to support an unwise and ultimate federal takeover of a huge segment of our economy. This is something we must not support. For these reasons, despite my ongoing commitment to cost-effective care and reform of underlying principles of our healthcare system, that everyone should have access to care, quality care, I am voting in support